Okay, we have our last presenter, and we're a little bit over time, but if you all can stay until the end, we greatly appreciate it. So I'm happy to introduce Brianna, who is also an MSPH student, and she is going to be presenting on risk factors related to skin cancer in people living with oculocutaneous albinism and prevention strategies in Africa. I just want to share a couple of notes about Brianna. She is grateful for the opportunity to gain analytical skills and further develop her existing skills in leadership and teamwork, and to make meaningful connections in the program. She really wants to thank her mentor Jeffrey and her friends and her readers for accompanying her in this journey. And her postgraduate plan is to work in public health monitoring and evaluation. Thanks, Brenda.
Well, good afternoon, everybody. I'm Brianna, and I will be presenting on the risk factors related to skin cancer in people living with oculocutaneous albinism and prevention strategies in Africa. I had the privilege to work with Dr. Kent as my first reader, as well as Dr. Gaylord as my second reader, who unfortunately could not be with us today because he is dealing with the loss of a family member. Well, but I hope he can still make it a little bit. All right.
Try clicking on put the mouse onto the.
Sorry about that. Okay, so this is the agenda for today. I will give a little bit of a background, and then I will state my research question and aim. I will talk about the methods, the results, discussion, implementations, and limitations, and then I will conclude for today. A little bit of a background. Now, what is albinism? It's a non-communicable genetic condition characterized by the lack of melanin in skin, eyes, and hair. There are two types of albinism. The first type is ocular albinism. Here, it's a very rare type, and only eyes are affected. Normal skin, but just messed up eyes like the rest of us. Oculocutaneous albinism is the second type. It's and our focus of interest, because not only it is the most common, but also it's the one that puts this population at great risk for skin cancer. And here everything is affected: eyes, skin, and hair. Under OCA, oculocutaneous albinism, we have two subtypes. We have the syndromic and the non-syndromic albinism. As far as the syndromic, it's not only the melanin that's lacking, but there's also other genetic mutations that leads to having immunodeficiency, bleeding, diathesis, pulmonary fibrosis, and so many more things. There are mainly two types of syndromic albinism here, CHS and HPS. We will not go into further details because it's a lot of biology and terms that I cannot pronounce. The second subtype of OCA is non-syndromic, which is my type. And here we have 8 different groups of OCAs. And the difference between all of these groups lie in the fact that the prevalence rate first, and then the features may look different. For example, OCA1 accounts for 70% of North American population albinism cases here in North America. So it's mainly Caucasians, and their feature, they have like reddish eyes and white hair. For OCA2, this is us, Africans, sub-Saharan Africans, African Americans, and we have yellowish hair, hazel eyes, and it goes from the most common to the least common. And the 8th type here was found, well, is currently being researched because it was found in one person in a large French cohort. So we don't have much details about that. So the lack of melanin in people with albinism here is associated with high risk for skin cancer. Since we don't have the melanin that protects us from the sun's UV ray, sun exposure is the biggest risk factor for skin cancer. And additional risk factors include age and family history. Age, because the more we grow, well, we work. And so unfortunately, we will talk about it later. People with albinism back in Africa don't always have the capacity or ability to land jobs that will allow them to work in office. And family history, because if you have skin cancer running in the family, you are also more likely to end up getting it. Now, although basal and squamous cell carcinomas are more common, melanoma is much more serious and fatal. Now, albinism has a lot of impacts that are decided to divide in 3 groups. We have the biological factors. Here is affected as the eyes, photophobia, which is the light sensitivity, nystagmus, the inability to focus. We have eyes that do the back and forth, and also legal blindness. The social factors, we have stigmatization, social exclusion, and family strains. I will give more examples. For example, a woman who gives birth to a child with albinism is unfortunately more likely to get abandoned by her husband and family because people think that people with albinism are witches. And about the stigma, people also think that they bring wealth. And so politicians they usually collect their limbs or unfortunately unalive them and to keep their limbs and body parts in order to win their electoral campaigns. Crazy. Okay. Psychological factors. We have low self-esteem and depression, unfortunately, due to the whole rejection and people comments. Yeah. Now, the life expectancy of a person with albinism a couple decades ago was of 30 years old, but due to the amazing community public health work that is being done by many organizations, today a person with albinism can have a normal lifespan. However, their symptoms, like if they have HPS, they could experience some bleeding, and that may shorten their lives. Also, skin cancer also plays a role here. I will talk about 3 organizations that are currently doing an amazing job. We have the Pierre Fabre Foundation, which has 31 programs in 21 countries currently. And what they do is that they fight for inequalities in healthcare access for this population by training dermatologists, supporting sunscreen production, and educating population on skin cancer. We also have NOAA, based here in America, the National Organization for Albinism and Hypopigmentation. They provide funding for researchers to educate more and bring awareness about the topic, but they also provide a safe space for people with albinism to feel supported because unfortunately, they do not experience a lot of that. My 3rd organization here is Corbeta, which belongs to my 2nd reader, Dr. Inena, back in Congo. He's doing an amazing job at treating people with albinism skin cancers for free and also provides a free sunscreen. Amazing job. Now, the research question that guided our master's thesis is, what are the known risk factors associated with skin cancer in people with albinism? And here we aim to identify the known risk factors and ways to reduce the risk of skin cancer in people with albinism. A literature review was conducted to explore the risk factors and preventative measures. And our eligibility criteria follows the PICAS framework. Our population of interest, people with albinism, intervention, sun safety measures, comparison, those who practice sun protective activities and those who do not. Outcome is the quality of life, and setting is Africa. Now, as you can see in my Prisma flow chart, my first search string only generated 40 articles, and this is from PubMed, WHO, Global Health Observatory, and also Google Scholar. In total, 40. That's not a lot. And some of these articles were eliminated because of some just provided a little bit of a background on it, or unrelated topics, or it was just abstract. But eventually, we selected 7 articles for this review that were divided in 2 groups. We have the reviews and the empirical studies. When it comes to my reviews, the study done by Wright and his colleague in 2023 found that shade provided by trees and built-in structures like gazebos, awning can effectively protect against UV rays exposure, but also the cost of sunscreen may discourage regular use, especially in low and middle income countries. We will talk about it more in the discussion piece. The study done still by Wright in 2015 found that strategies for sun protection, including wearing protective clothing, hats and sunglasses, sunscreen, and seeking shade. But then the adaptation of these measures depends on the personal awareness, attitudes, policy support, financial resources, cultural acceptance, and product availability. The study done by Hong and her colleagues found that people with albinism face not only health challenges, but also psychological and social difficulties. Now, when it comes to my empirical study, my Moiré-Touré conducted a retrospective analytical study by abstracting data from 5 dermatological consultation campaigns from 2019 to 2021, and found that the most common type of skin cancer in this population was found to be basal cell carcinoma. Seka and his team as well conducted a cross-sectional study by also getting data from 2 rounds of free consultation by mobile clinics, skincare clinic, and found that a significant majority of people with albinism experience premature aging of skin, possibly due to sunlight sensitivity and exposure. As well as Seka and his colleagues, Dr. Inena, my second reader, did a cohort study of his actual patients who were diagnosed with skin cancer. This will be a hard one to read. He found that patients with albinism had various skin issues, including solar lentigines, skin arrhythmia, actinic ptosis, actinic cheilitis, also skin lesions concerning cancer varied in size, and ulcerated tumors being the most common morphology. Last but not least, this was one of my favorite articles to read, actually, by Wright and his colleague. They conducted a descriptive cross-sectional study by selecting randomly schools in South Africa and sending out surveys to the principal for 4th graders to fill up. And then once they were done, they sent back the data. Well, they sent back the answers, and then they abstracted data and did some linear regressions, and found that there is no correlation between knowledge and behavior, meaning that knowing about the harmful effects of the sun does not translate into sun safety practices. Discussion, also divided in 3 different groups. Environmental factors. The shade options are available. Yes, but their effectiveness is contingent to their quality and availability. I read in one of my articles that shade is good, but then also they talk about umbrellas. It's good to have them, but then also protective clothing overall. But then the quality gotta be good in order for for it for these people to be protected against the UV rays. Social factors, according to me. The biggest problem here is poverty, because already if people think that, people with albinism are witches. So and also they think that albinism is a handicap. So it's like, no one really wants to trust you with a position. And so they turn out to be outdoor workers, which is not good for their skin because there are great risks for skin cancer. And so even if they do outdoor work like labor or fishing and try to sell their produce, who wants to buy it if everybody thinks you're a witch? So it's a problem. It's a very, very big problem. I think it makes no sense to me, because why do you think that this population can bring you wealth, but then themselves they're not rich? It just makes no sense to me. But hey, inadequate access to medical care. In one of my articles, it was stated that people with albinism often have bad experience at the doctor's office because of the discrimination and stigma and everything. Also, the lack of community empowerment, a lack of conducive learning environment and services, which is 100% true. I remember when I used to be a student back in Congo, in a setting like this, I would literally pull up a chair in order for me to be able to see the board and make notes. We do not have accommodations that we get to have here. Also, limited community engagement events, prejudice, stigma, and all of this affects the well-being of people with albinism. Now, when it comes to the psychological factors, a mistrust and fear due to violence and discrimination from the society and medical personnel. Like I was saying a couple minutes ago, lots of them have bad experience at the doctor's office. Like if I went to 2 clinics, for example, and I was mistreated, well, I wouldn't go to a 3rd one because it's all the same. And it's not even like they have the money to be like, okay, since they can't treat me here, I'm gonna go to Paris. No, they don't have that. So unfortunately, it's hard out there. But then addressing these issues raised will necessitate the collaboration of politicians. They need to stop cutting their limbs in order to win their election. It's not true. Healthcare providers, educators, and community leaders. Implications and limitation. I found that there's a missed outcomes due to limited scope of literature review. Like you saw in my Prisma flow charts, there's not much on it. I even tried to go quantitative on this paper, but no data available. So it's either you conduct your study right then and there, or you just go for a literature review. But then there's not much out there, unfortunately. Also, funding is needed to help researchers and healthcare providers to support people with albinism. For example, my second reader, Dr. Inena, he's doing this amazing job, right, providing and helping this community. However, I think if he was supported by the government, for example, maybe he would have had better equipment for his clinic and everything. And I know most of a lot of researchers, they're trying to help this community. They're trying to bring awareness, but then the funding is needed. They need that financial support. Also, limited access to affordable sun protection measures. I read, again, in one of my articles that people would rather get a piece of bread instead of buying sunscreen because it's expensive. If sunscreen is like $20, $30, and $60, and they only gain $2 per day, when they get to have money, of course they would want to feed their families. And so sunscreen needs to be affordable, and also other preventative measures. And last but not least, the misuse of sunscreen, especially by youngsters, allowed me to conclude that there is a need for comprehensive awareness campaigns to foster a culture of sun safety measures. In conclusion, The risk of skin cancer and possible prevention strategies for people with albinism represent an under-researched area, causing a significant limitation in our capacity to understand the risks and improve the overall well-being of this community. But with robust research, developing tailored awareness, preventative methods, and treatment is possible. I would like to thank my first and second readers, Dr. Kent and Dr. Inena, because it has been a long journey, but then we made it. I would also like to thank Jeffrey. He's been my #1 supporter, like since day one. Also my cohort. Thank you guys. And also thank you to everyone for being connected on Zoom, especially those who are in France and Congo right now. Merci, merci, merci. Thank you.